ORS 423-560 requires counties to convene a local public safety coordinating council, and it's tasked with two things. I'll read from the statute. Number one is to develop and recommend to the County Board of Commissioners a plan for the use of A, state resources to serve the local offender population. And that's what I'm here for today.
At this month's local Public Safety Coordinating Council meeting, Jackson County Community Justice Director Eric Geyer gave an overview on the county's community corrections efforts and presented data indicating their effectiveness so far.
The local Public Safety Coordinating Council, ORS 423-560, requires counties to convene a local Public Safety Coordinating Council, and it's tasked with two things. I'll read from the statute. Number one is to develop and recommend to the County Board of Commissioners a plan for the use of A, state resources to serve the local offender population. And then it also asks for us to do a similar process for the juvenile population, age 15 to 18. And then it also asks us to coordinate local criminal justice policy among affected entities. We do spend most of our time in our agenda space on the last one, on number two, but we're required to do number 1A, and that's what I'm here for today. So we'll talk about what that plan is for state resources to serve the local offender population. 423-478 talks about Community Corrections Act funding, and it says that in partnership with the Department of Corrections, we shall assume responsibility for community-based supervision, sanctions, and services. And it's for offenders convicted of felonies and some designated misdemeanors in terms of the cases that we provide supervision for. And the profile for Jackson County says that 35% of the people we supervise are considered high risk to recidivate. Compare that with the state average of 20% to recidivate. On the state level, 48% are considered a low level to recidivate. Low likelihood to recidivate would be the way to read that. In Jackson County, only 36% of our folks are considered a low likelihood to recidivate. We were lucky enough to have a couple of OHSU nursing students do their practicum with community justice, which I always kind of pride ourselves in, that people would identify that from a nursing standpoint as a place that they wanted to do their practicum. And one of the projects they did was they conducted a client survey for us, and they talked to 74 different individuals, people on supervision in our office. And they were trying to measure ways to promote resiliency, which they defined as protective factors to survive and thrive from significant adversity and stress. But when they did this survey, they found that 91% of those folks found that they could be honest with their PO. 82% believed that their PO is teaching them skills, and 57% felt helped by community justice. We are working on that 57%. So when we look at our major intake, and this is over the biennium, in terms of where our funding comes from, $20.6 million will come from the state in the form of Community Corrections Act money in the next 2 years. This represents an increase both in terms of the percentage of the overall state budget that's being spent to counties. Our county has a higher percentage of those people now. 7.42% of the supervised population in the state is in Jackson County. Per capita, we're 5.5% roughly of the state population. So that money's coming down, and then the rate at which they're reimbursing us for those services has also gone up. Over the legislative session, we argued and fought and articulated as to why it was important for them to really put on a per case level a greater amount of money and funding and resources, because we said that that money leads to smaller caseloads, more support services, and alternatives to prison that really save the state money in the long run. And the state agreed and made that investment. We also have grants and fees that'll open up a little bit about here. $10.3 million over the biennium will be through those. And we get a general fund investment into adult services from our county, which prioritizes public safety and identifies the fact that transitional housing beds, enhanced DUII services, and a strong community justice department is important within that milieu, within that array of services. When we talk about the transition center and we talk about the people that we serve who are without housing, we provide up to 45 beds of services per day for people in our community who would otherwise be unhoused so that they can live. And they don't just have a place to live, they have a place that has case management, mental health supports. And when I say case management, that's everything from employment, health services, work around their finances and budgeting. We teach these people skills. And to be very frank, the people that we serve within our transitional housing are people that are often unsafe in other transitional housing resources within our community. And I think that gets lost sometimes, the volume of people that we serve. A person getting out of prison, instead of coming back to our community unhoused, with a duffel bag that's, taped together. In our community, they come and they have housing. They immediately start engaging in services, whether those be support services around employment and healthcare, or alcohol and drug treatment and skill building.
Yeah, I'm just going to put an exclamation point on that.
Yes.
So a lot of people want to know, what's the county doing to help with the homelessness issue? I think the county, out of every local government, probably spends the most direct general fund dollars on this service. Of that $5.4 million, about $1.5 million goes into this particular project. So we're spending $1.5 million a year directly serving people that would otherwise be homeless.
I like to give a scope of what I'm talking about today in terms of what we do, because it's not just about adult parole and probation, it's not just about jail, and it's not just about the transition center. But we have 200 people right now who are currently receiving pretrial supports and supervision and monitoring in our county right now. Over the last biennium, 759 adults received employment services. We did 1,277 DUI intakes. Mental health clients, we opened cases and supports for 251 different individuals who are at justice involved and in need of a support. We provided 26,180 hours of community service, and we dispatched 2,801 work crews from our transition center and community service programs. One of the primary functions that we do under supervision and sanctions is the Supervisory Authority. Senate Bill 1145 back in 1995 and its follow-up bill, House Bill 3489, created a new relationship between the state and counties in terms of how community corrections services were provided. It allowed for counties to impose sanctions other than incarceration unless the sentencing court finds substantial and compelling reasons that the defendant be incarcerated. The provision is intended to allow counties to design a treatment program that gradually works the adult in custody back into the community. The role of the Supervisory Authority is to facilitate the escalation, if necessary, and de-escalation of justice-involved individuals to ensure that the least restrictive form of custody is used to hold individuals accountable while completing their sentence. The movement could include the following forms of sanctions. We have jail, we have the transition center. It could include home detention, residential treatment, electronic monitoring, increased reporting, and it could even include community placement. Our staff work with the jail to ensure that sanctioned and sentenced individuals have appropriate accountability and movement within the continuum of sanctions. The Supervisory Authority tracks sanctions and local sentences of 365 days or less to their completion. And we have a team of staff dedicated to tracking these sentences and moving individuals to the most appropriate level of custody as they serve sanctions and sentences. So getting out to the transition center, we have 145 active beds currently, 74 sanctioned beds, 40 transition beds with the ability to add 10 more if necessary by population, 16 federal transition beds, and 15 residential treatment beds. And then our 15 residential treatment beds is in our transitional care program. I'll talk a little bit about that. It is one of the only programs in the state that has passed the correctional program checklist. I will continue to say that because that team deserves kudos. It's not easy to pass. So out at the transition center, we offer different services and supports that are really unique within a correctional setting. We offer employment services. We have the Pathfinder Network out at the transition center. We also have a medication-assisted treatment program out there, and that's unique to our spot where we can leverage some of our community resources to make sure that that happens. And the Addictions Recovery Center has a peer mentor who provides supports around MAT to really find that kind of person who is working to engage it and then make sure that that success is carried on when they're out in the community. We offer job skills, which could be everything from firefighting and fuels reduction. I mentioned the workshops and the resume building. And then we have residential treatment. So the transitional care program, which is funded through JRI, I'll get to that in a minute. But we're talking about 15 adults, they've been justice involved. They've had drugs have been a large part of their life and their criminality. And we're able to engage them in a residential treatment program that is specific to their needs. I mentioned that corrections program checklist, which is really an audit process where you go through and it's evidence-based. Dr. Carter has been instrumental in this process over time. But it's evidence-based in saying these are the things that work for people who are justice involved. And then Jackson County Mental Health has a dedicated person out of the transition center to provide supports, assessment, and referral, as well as ongoing work if needed. So 1,878 individuals on supervision right now. That's generally what we're looking at. This plan would call for 31 parole and probation officers, which would be an increase of 4. It would allow us to have caseloads for the high-risk individuals that most need services. It would provide for 8.5 peer support specialists through the Pathfinder program. And I've said this a lot, and I don't mean to be flippant about it, but what we used to do within parole and probation, if somebody came in and they were sick, and you could tell that they'd been using, and they had been hurting, One process was to send him to jail. The others was to say, you know, I can tell that you're tore up from the floor up, as they say, and you need to get to treatment. And we didn't have great outcomes. We didn't have a lot of people that would follow through with that. We didn't have a lot of people that were ready for that. And so getting a peer involved in the process with a warm handoff within our office allows for that relationship to start, for those arguments for change to begin to take hold, and to meet those people in a way that truly creates long-term success. So while that person might need alcohol and drug services, it's the peer that can really help get them there. PO can reinforce a number of things, can teach a number of things, but the peer really provides a service that we just haven't had before. The Adult Parole and Probation also has the Resource Center, which we started to work with people getting out of jail, and has since been something that justice-involved people, whether they be pre-trial, whether they be in our office for supervision, can immediately connect with a worker who will get them signed up for the health plan, can get them a letter to help with the DMV for their identification. We have employment and housing services, accesses in this building. Our employment specialist is there, as well as alcohol and drug support for those people who are ready for treatment. And we have embedded mental health supports from Jackson County Mental Health, both a peer to deliver services, as well as a mental health specialist. When we supervise cases at adult, we supervise them based on risk. So people the highest risk to recidivate are the ones that we're going to focus our efforts on. We're going to then, for those higher risk individuals, use an assessment process that identifies their criminogenic needs, what is it that's fueling their criminal process, and then we're going to target those needs. And then finally, we're doing case planning and skill building. So the idea that we sit collaboratively with a person, identify the needs they're ready to work on, and then teach skills around it. And then within parole and probation, we have a number of different types of caseloads. We make sure that we use specialized caseloads whenever possible. So certainly sex offenders or people who've committed sex offenses, we have a set number of them that are on sex offender caseloads, domestic violence, and gender-responsive caseloads, knowing that we can get better outcomes and utilize different tools within those. We have a specialty court caseload, reentry court caseloads for people coming back from prison, and geographic caseloads, knowing that if we can get community-based and focus within certain areas, we can have better outcomes and connect with resources more directly. We also have a 416 diversion caseload, which are people who otherwise would have been imprisoned, and we're providing supports and accountability locally. I will speak more in depth on that one. Two notes regarding our parole and probation services over this year. Senate Bill 620 passed at one of the last weeks of the legislature, and it eliminated supervision fees. So we've charged those historically since the onset of 1145. We had budgeted $450,000 over the next year. We can't charge that right now. The state did make an effort to reimburse that. They add $371,000 back for fee reimbursement. It doesn't cover the amount. And so we're making that back up through other investments that the state made in this population. The other piece that the state did is that they funded misdemeanor domestic violence and sex offender for sexual abuse in the third degree. These are cases that historically our county had invested in to try and provide supervision for, knowing that the lethality associated with domestic violence, the harm it does to our community really required that level of support, and now the state is picking that up. So we will have services here. In terms of what we need to vote on today, the first would be the Community Corrections Act program. Our proposed budget for the biennium has a total application cost of $20,631,590. It incorporates the jail for $3.4 million, the transition center at $4.8, supervision services at $9.3 million, as well as transitional housing supports, the Pathfinder Network, mental health services, and sex offender subsidy. This entire program will be submitted to the Board of Commissioners upon the recommendation of the LIPSIC, and then it will go to the Department of Corrections, where they will say that it meets their status. But we build it in partnership with the DOC. So those are kind of the processes that would be next.